Welcome to the deep dive. Today we're taking a really fascinating look at the kidney's two organs that, well, they really run the show, operating quietly in the background as the body's ultimate chemists.
Hmm.
We've pulled together some great sources that detail their incredibly complex functions, the startling array of symptoms when they fail, and how doctors figure out the cause of that failure.
And they are, without any exaggeration, absolutely essential.
Right.
As your sources stress, you can live a perfectly full life with one healthy kidney, but you cannot survive with zero functional kidneys.
So their main job is filtration. That's what everyone knows.
That's the headline, yeah. They cleanse the blood, they work with the liver to get rid of toxins, and this is the crucial part, they perform this really sophisticated task of reclaiming essential things the body just cannot afford to lose.
You know, it's often just described as a filter, but that word almost feels too simple. It really minimizes the sheer workload, doesn't it? We're not talking about a simple kitchen sieve here.
Exactly. It's a complex chemical factory. And beyond just waste management, they have these vital endocrine functions.
Oh, right.
They're the key organs for activating vitamin D, which is absolutely necessary for keeping your bones strong.
Okay.
And maybe most surprisingly, they secrete erythropoietin, or EPO, which is the hormone that signals your bone marrow to make red blood cells. So your blood itself depends on the kidneys.
That is just a profound paradox.
Yeah.
An organ system that's mainly about excretion is also essential for things like bone density and preventing anemia.
It really highlights how serious chronic kidney disease is. When the kidneys start to fail gradually, one of the earliest signs physicians look for, besides fluid issues, is a drop in that EPO production.
And that leads to anemia.
Directly, it leads to chronic, often very severe anemia because the body just isn't getting the message to make enough red blood cells, even if the bone marrow is perfectly healthy.
Okay, so let's unpack this intricate system. When this vital machine starts to, sputter, our sources detail up to 14 different symptoms. So our mission today is to identify those critical warning signs, from subtle fluid shifts to life-threatening heart problems, and understand the three major ways medical science classifies why renal failure even happens.
Let's do it.
So let's start with the most immediate and, I guess, mechanical sign that the filter is slowing down: fluid. The first major warning sign is a drastic drop in urine output.
Right. In medicine, we often call this oliguria.
Oliguria.
And it is a huge red flag. It means the amount of urine you're producing has dropped, really quickly and significantly, assuming you haven't changed how much you're drinking.
Okay.
And if the output stops no urine at all, which we call anuria, that is a profound, immediate medical emergency.
And simple physics dictates that if liquid isn't leaving the body, it has to be staying somewhere.
Exactly.
Which brings us directly to symptom number 2, edema, swelling.
Edema is that classic puffy look, especially in the dependent areas of the body, so your feet, your ankles, your legs.
Where gravity takes over.
Precisely. This is a massive accumulation of fluid in the subcutaneous tissue just under the skin. It happens because the kidney has failed to maintain what we call a neutral fluid balance. Instead, you're in a state of positive fluid balance.
So if the kidney is the fluid faucet and that faucet is suddenly closed,
Then all the liquid you drink just stays inside. If that faucet is failing, the body can start retaining liters of excess fluid.
wow.
Now, we should say, while edema is a hallmark of kidney distress, heart failure also causes it.
Right.
But a key difference doctors look for is how fast it comes on and what other symptoms are there. But either way, sudden, persistent swelling is a major warning sign.
And that extra volume isn't just sitting there, right?
Yeah.
It immediately starts to impact the body's central engines.
No, absolutely. When that fluid balance becomes significantly positive, the sheer volume of liquid puts this overwhelming pressure on your cardiovascular and pulmonary system.
And that shows up as a...
Symptom number 3, dyspnea, shortness of breath. The excess fluid can accumulate around the lungs, making it hard to breathe. You get this feeling of air hunger.
So the kidney, which is tucked away in your back, is causing a breathing problem just by failing its mechanical job.
That's it. And that volume failure also directly explains symptom number 4, arterial hypertension, high blood pressure.
How so?
The kidney is designed to manage the total volume of fluid in your circulation. If it fails, that volume just skyrockets, and that increases the pressure against your artery walls. Sudden, severe spikes in blood pressure with no other explanation are a powerful sign of acute kidney failure.
Okay, this is where it gets really, really interesting. Once we move past that immediate mechanical failure of fluid management, we start seeing the more insidious signs of a biochemical crisis, the slow poisoning from toxin buildup.
And this often starts off really vaguely. The sources list asthenia, which is just generalized tiredness, fatigue, a real lack of energy, and confusion. This cognitive issue is particularly important in older patients who might suddenly have poor concentration or seem out of it for no other obvious reason. These non-specific symptoms are often the very first sign that uremic toxins are building up.
And I imagine those accumulated toxins lead directly to severe stomach issues. We're talking about nausea, a chronic urge to vomit, or, outright vomiting.
It's the body's last-ditch effort to get rid of substances that the kidney should have cleared through urine.
Right.
But what's truly alarming is how the kidney's failure to manage ions impacts the heart, a totally different organ system.
You're talking about symptom number 8, arrhythmias. How does a filtering problem turn into a severe heart rhythm issue?
So the kidney is the master regulator of electrolytes, and specifically potassium.
Okay.
In renal failure, potassium levels can spike dramatically, a condition called hyperkalemia. The heart, well, it runs on this delicate electrical gradient based on potassium moving in and out of cells. Extreme hyperkalemia completely destabilizes that gradient, leading to life-threatening cardiac rhythm problems, which can very quickly become cardiac arrest. That's why kidney failure escalates to a cardiac emergency so fast.
Let's shift now to one of the most visible signs, a very specialized signal that the filtering structure itself has been physically damaged. Increased foam in the urine.
This is such a critical indicator. A little bit of foam is normal, but if you notice a persistent increased foam that doesn't go away quickly, maybe it's more than a finger's width, you really should pay attention.
Why?
It's a telltale sign of protein loss, or what we call proteinuria.
And proteins, unlike simple toxins, are huge molecules.
They are the big-ticket items. Think of the glomeruli, the kidney's filtering units, as these microscopic, incredibly fine coffee filters.
Okay.
A healthy kidney is designed to hold on to every single essential protein for muscle, immunity, all your organ functions at all costs. If that filter is damaged, large proteins like albumin start to leak out.
And that leaking protein is what makes the foam.
Exactly. When it's agitated by urination, it creates that persistent foam.
So that visible foam is basically the body screaming that its most crucial building blocks are being thrown away.
Precisely. It's an involuntary self-diagnostic tool. And speaking of things that shouldn't be there, we also have hematuria.
Blood in the urine.
Yes.
Does hematuria always mean the kidney is failing?
Not always, no. It can come from downstream, the ureter, the bladder, the prostate.
Right.
But it is also a sign that the filtering units in the kidney itself are damaged and bleeding. It definitely needs an immediate investigation to find out where it's coming from.
Okay, now we move to some symptoms that, thankfully, often signal very advanced stages of kidney disease. But they're crucial to know because they really highlight the severity of that toxin buildup. Symptom number 11 is pruritus, just severe, relentless itching.
This is one of the most miserable symptoms for patients with advanced failure. It's caused entirely by toxic substances, often calcium and phosphate byproducts, that the kidney failed to eliminate. These circulating toxins get deposited in the skin and they irritate the nerve endings, causing this persistent, uncontrollable itching all over the body.
That's a powerful demonstration of how that toxic load just tries to escape through any pathway it can find.
It is. And other advanced effects you see in the sources, which are rarer now thanks to earlier diagnosis, include a persistent metallic taste in the mouth.
A metallic taste.
Yeah, or even an ammonia smell on the breath.
An ammonia smell. Why?
It's a sign of advanced uremia, where waste products, particularly urea, are so high they're actually trying to exit through your lungs, which affects your breath and your taste receptors.
That's incredible.
As you said, though, thanks to better diagnostics and control of chronic diseases like diabetes and hypertension, we catch these problems much earlier now, preventing that kind of end-stage toxicity.
So if we connect all these symptoms to the bigger picture, it's vital to understand why this is happening.
Absolutely. Medical professionals use a very practical, almost geographical classification system that divides the causes of kidney deterioration into 3 categories based on where the problem starts.
This classification, pre-renal, renal, and post-renal, it seems incredibly useful because it points you to the right treatment path immediately. So let's start with pre-renal.
Pre-renal means the problem is happening before the blood even gets to the kidney's filters.
Okay.
We have to remember the kidney is entirely flow dependent. It needs adequate volume and pressure to filter. So pre-renal causes are all about hypoperfusion, not enough blood volume reaching the organ.
So anything that causes a major drop in your circulating volume.
Precisely. General dehydration, severe bleeding from an accident, massive diarrhea, or a really high fever. All of these result in systemic volume loss.
So the kidney itself isn't damaged initially.
Right, it's not. It just senses that the flow is too low, and it shuts down filtration as a protective measure. But if you don't treat that underlying volume loss quickly, the lack of oxygen and stress can turn a temporary pre-renal issue into permanent renal damage.
That need for constant high-volume flow really emphasizes why dehydration is so dangerous.
Mm-hmm.
Okay, Category 2 covers damage that happens directly to the filtering units themselves, renal causes.
But these are the intrinsic problems, yeah. The ones that directly affect the kidney tissue or the filtering apparatus, the glomeruli, this is where you see inflammation and actual tissue destruction.
What are the main causes here?
A major one is glomerulonephritis, which is just a fancy word for inflammation of those microscopic filtering units. It's often the immune system, or sometimes chronic infections, causing damage and scarring to the filters.
Okay.
Autoimmune diseases like lupus are also notorious for causing this kind of direct, aggressive renal damage.
I noticed the sources also specifically mentioned rhabdomyolysis in certain drugs.
Yes. Rhabdomyolysis, that's the rapid breakdown of damaged muscle. It releases huge amounts of a protein called myoglobin into the blood.
And that's bad for the kidney.
It's highly toxic. It essentially clogs and chemically destroys the delicate tubules inside the kidney, causing acute renal failure right at the tissue level. That's why it's a risk for athletes who push way beyond their limits or, victims of severe crush injuries.
Got it. And finally, we have Category 3, post-renal causes. This is the plumbing problem, right? The kidney is filtering fine, but the system is locked.
Exactly. Post-renal refers to issues that happen after the kidney, blocking the outflow from the ureters, bladder, or urethra. The theme here is obstruction. If the urine can't get out, it backs up.
And that backup creates pressure.
Massive pressure. It builds up inside the kidney structure itself, and it effectively drowns the filtering units.
One of the most common blockages.
Well, neoplasms, or cancers, particularly of the bladder or prostate in men, can squeeze the urinary tract shut. But the most frequent and painful cause is kidney stones renal calculi that break loose and get lodged in the narrow ureter, creating a complete and agonizingly painful blockage.
So you could have a perfectly healthy kidney, but because the drain is clogged, the pressure builds and just halts everything, causing failure.
That's it exactly. It's a hydrostatic pressure crisis. And if that obstruction isn't cleared quickly, that backup pressure starts to cause permanent damage to the otherwise healthy kidney tissue.
This whole deep dive just emphasizes the need for, well, consistent care and recognizing the risks. The source material really reminds us that controlling chronic illnesses like hypertension and diabetes, managing things like obesity, avoiding tobacco, and being careful with over-the-counter anti-inflammatory drugs are the best proactive steps we can take.
Without a doubt.
So let's just review the key takeaways here.
Yeah.
We've established that the kidneys are profound regulators. They handle endocrine functions, EPO, and vitamin D, and they act as the core managers of fluid and ion balance.
They're far more complex than just a simple disposal unit.
Absolutely.
And understanding that symptom progression is just paramount. Whether it's the immediate mechanical volume changes, the low urine output, the swelling, the shortness of breath, or those high-stakes biochemical signals like foamy urine showing catastrophic protein loss.
Or the arrhythmias from potassium imbalance.
Right. All of those things require immediate medical attention.
This brings up a really important question, I think, about the body's inherent hierarchy of substances. The fact that the kidney is designed to retain proteins at all costs, and that their loss triggers such a visible, recognizable alarm signal like persistent foam. It just tells you so much about the foundational, life-sustaining importance of those proteins for our body's basic structure and immunity.
It's the body prioritizing what is precious above everything else.
And for a final provocative thought for you to consider, why is the sudden loss of volume a pre-renal issue, a problem of such immediate and severe consequence for a filtering organ? What might that imply about how quickly the body's flow state can shift from survival to failure? Think about that dynamic nature of volume management versus the slow, creeping damage of chronic disease.
The kidney lives in the present. It demands constant high-pressure input to function correctly.
Absolutely. Thank you for joining us for this deep dive. We'll catch you next time.